everyone, and very welcome. My name is Fahima McGregor, and I am the founder of Informed Impact, a continuing professional development initiative where we partner with leaders across different sectors to amplify their voices on innovative leadership and human-centric transformation. Through this series, our goal is quite simple: to bring forward conversations that inform communities with impactful knowledge, helping professionals and organizations strengthen the way they lead, decide, and adapt. Today, we have privileged to have Natalia, the Manahautū at DCM and a recognized leader in Wellington's homeless sector. Natalia will share her insights and experience on how data-driven leadership can drive social change, balancing evidence, narrative, and human impact in one of the most challenging yet inspiring areas of social service. Before we begin, just a quick note on housekeeping. Please keep your microphones on mute during the session and feel free to use the Q&A chat box. The normal chat is not activated for this meeting. The Q&A is available. We will have time for the reflections towards the end, and if you would prefer to ask question rather typing it, again, we are hoping that we can accommodate time. You can unmute yourself and joining the discussion. With that, it's my pleasure, Natalia, to hand it over to you. Thank you so much for your time and your support.
Oh, thank you, Fahima, and welcome everyone. There's some familiar names on the screen, but I've got you in a tiny box so that I don't have to look at you while I go through the presentation. I don't know what's worse, having a whole lot of people that you know or not very many people, or all unknown. So it's good, got a bit of a mix here. Just a little bit about myself. So I am from Wanganui originally. I now live in Wellington. I've been here since 2004. I moved to Wellington to study social work at Massey University. They did it in Palmerston North, but it was a little bit too close to home. So I wanted to stretch the wings a little bit and move to Wellington. And when I came here, I immediately loved the place. After finishing my degree, I worked at Child, Youth and Family, which is now Oranga Tamariki, and was a frontline social worker for a few years before moving into the Chief Social Worker's Office, where I worked in quality assurance and social work best practice. All parts of that organisation challenged my assumptions, my bias, the things that I believed about the world, particularly around child protection and welfare. And I remember feeling very naive and quickly learning that that great parenting wasn't what the organisation was seeking, but good enough parenting, and trying to understand that as a brand new social worker that wanted to change the world was quite confronting. I've got sort of more of a background in human services, and when I had met Fahima a few years ago and we started talking about data, I had obviously already used data quite a bit in some of my previous work, but had kind of written myself off basically. I failed maths at school despite having many thousands of dollars spent on me with tutoring. It just didn't come to me, and so the whole idea of sort of data and evidence and numbers kind of put me off. But actually, as you start to look at data and evidence through a lens that you're really passionate about and interested in, that comes alive for you, right? So I'm probably in a room full of people who have varied experience and skills, and you've come through into your current roles through different channels, and you've got different levels of expertise, but there will be areas of our work that we feel inadequate or a bit of imposter syndrome. But my challenge to myself and to others is find the part that you're interested in and navigate those challenges into the areas that you're interested in. So I say I'm a bit of a budding data geek. It's still relatively new to me. So when Fahima had asked me to do this, I felt quite nervous about it. But my hope for today is that people in this room would ideally actually feel encouraged that the work that you're already doing is it's on track, or it's even better than what others in the sector are doing. I don't know about you, but I often attend these things already thinking that I'm far behind, or that our organisation is steps behind everybody else, and actually find it kind of encouraging to come away going, oh, I learned one or two things, or I thought about something slightly differently, but actually we're not so far behind. So those are some of the hopes for me, for you, for this session. So here they are. Be encouraged. Perhaps you might want to tweak a little approach that you currently have in place, but through this conversation, you might be thinking about something in a different way, or perhaps there might be something completely different that I can encourage you to look at today. So in the session, we'll explore a few areas, sort of why data matters in social services, what should we measure, how to get the data, the human factor, critical, and that's, when I say team, I mean your own organisation, and when I say end users, I mean people outside your organisation. And there'll be time for Q&A afterwards. So we'll get through it fairly quickly, so that there's time for discussion if we have that. So why data matters? So I believe that this question, or the question of why does data matter, is inextricably linked to who it's for. So I'll take you through a little bit of what we use data for in social sectors, and talk a little bit later about who that's for. But you'll see the who as we go through the what. So firstly, essentially to measure impact and value for your own organisation. And so you're thinking here about what are your strategic goals, what's your organisation's vision and mission, and choosing data sets that will tell you about the health of your organisation. So these are things where, regardless of which role that you have, if you have an ability to influence what data you're using or what you're collecting, it really should first and foremost be connected to your business plan and what your strategic goals are. Often we're talking about contracts, but ideally you're starting with what is it that we need to know as an organisation to know whether or not we're being successful in achieving our goals. So often those are things that CEOs, senior leaders and board would want to know. The other part is, like I was saying, the contract requirements. So in the social services, we're often told by our funders and contractors, or if you are in this room, someone who contracts other organisations, and we've got some from the public sector in this group right now. We're often, as NGOs, talking about responding to the requests of others about which data that they want. And obviously that's really important because that's who funds us, and those are the services that we're funded to deliver. I would say also, when you're making decisions around funding, that you should be connecting contracts to your strategic goals and business goals, right? So even if a contractor is asking for particular information, ideally, in an ideal world, what they're asking for isn't too disconnected from what you're already agreeing to and wanting to as an organisation to deliver. So data also provides service delivery insights. So that's for your own service. So what are the gaps and opportunities that you're in what you're currently providing? Often these are outputs. Often there are things around the number of, or how often you have done a certain activity, or the types of people that use your services. So, for example, in our organisation, which is an NGO working with a particular population of people, some of the data and insights that we want to have is definitely around demographics, but also around needs that people come to our service with. And so that is around determining, are our services fit for purpose? Are there areas in our service delivery that are not meeting the particular needs of the people coming through our door? But how would we know that if we didn't know the complexity and the demands of the people that are coming through our service? So for your own service delivery insights, data can inform those things. It turns some of your gut feeling into having evidence to inform your gut is really important. So follow your gut feeling to ask the question, but use the data to inform your service delivery insights. So there's also strategic decision making, which obviously connects to the organisation's strategy. But some of this might be around, for example, that you're working on a plan for retention. So you're specifically interested in trying to retain staff or even recruit, but let's take retention for an example. So you might want to be looking at your HR data to tell you a little bit about which team people are leaving from. Is there a particular service that people tend to not stay around in for longer periods of time, or likewise, are there teams that people are in that stick around? It won't give you the answer, but it will tell you something about where to look. And finally, using data because staff feel valued when they get to see the outputs of what they're doing. One of the things that we've started to do in the last probably 18 months in our organisation is share our dashboards with our staff, so that the dashboards that we share with our funders and contractors, actually presenting that to our staff first and doing a bit of a test with them about, does this feel right to you? Is there something that we're missing? Do you think maybe there's some data that should be in here that's not coming up in here? And it creates buy-in with your staff. I was going to take you through, I'll talk briefly about this. So this is around, I'll take you through this. So this is a bit of a real life story, I suppose, around data. So people know around Florence Nightingale. So she was a nurse. She was sent to a British military hospital in the Crimean War in the 1850s. And what she found was absolutely horrifying: overflowing sewage, feces on the floor, overcrowded wards, just lack of basic supplies, etc. Now, she believed that it was the foul smells in the room that were the issue. And so she took action. She opened windows, cleaned floors, improved nutrition, introduced some basic hygiene, but wanted to flush out the bugs. And that was fine, but actually it didn't make a huge difference to the death rates. So the story shifts at this point. She didn't stop at assumptions. She could see that the things that she was doing wasn't really making much of a difference. So she began collecting data around the cause of death and hospital conditions. And with the help of a statistician, she created the Rose diagram, which is that picture on there. So it's just a visual tool that represented the different causes of death and the different size wedges showing the frequency. So what her data showed is that the vast majority of deaths were from preventable diseases and not battle injuries. And it challenged this long-held belief around what was creating this higher rate of death. And it showed that poor sanitation and contaminated water and inadequate waste disposal was the actual killer. So what happened is that then they obviously shifted their practice within that hospital, and there was a marked improvement in the death rates. It's a dramatic example, but it's an example of where in the real life where you have an assumption, you take action, and you could keep going doing that. It takes courage to stop and go, this thing isn't working. We need to understand why. Let's stop and collect some information for a while to make sure that our activities and our inputs and our outputs are going to be fit for purpose to solve the problem that we're trying to solve. So this kind of leads us on to, what should we be measuring? Like, what is the problem that I'm trying to solve here? I think often we jump to trying to collect information for the sake of it, but people will know about the 5 whys, and that's such a powerful exercise when you're thinking about finding out another piece of information, just stopping and going, but why do I need that? And why? And why? And why? And just working through until you've really understood, is there benefit to that, gathering that information, and what problem is that going to solve once you have that data? And it should always come back to, what are your business goals and what's your strategic plan. But every organisation needs to consider their unique position. I know that there are times when we've collected data, or I've collected data because I'm particularly interested in something. It might not connect to our BAU or something that we're trying to achieve right now, but it's given us something that we might want to be thinking about in the future. But to know whether or not that's something that we want to look at in the future, we want to know a little bit about it now. So keep asking, what's the problem I'm trying to solve here? And I guess it's being mindful that every time that you add something else on to what you're wanting to understand, that's one more piece of work that your frontline staff are needing to do, and knowing that there is often a time consequence or a resourcing payoff that you need to make in asking people to move into a new area or to collect something else, and being mindful of that. And there's always the problem that it will just never stop. And if you have a curious mind and you've got some really good tools within your organisation already to collect and analyse data, the questions and the drawing out of new information and the collecting of different information will just be endless. So being mindful that you need to, at some point, come back to the 5 whys. I'll just talk a little bit, I'll leave it on that, just talk a little bit around, a bit more around sort of who data can be for. Actually, no, we'll move on. I'm kind of conscious of time. No, take that back. I'm going to give you a couple of examples of where we've used advocacy data to inform ministers, where we've used journalist relationships, where we've used numbers and narrative together to create some advocacy and change for people. Because I think part of the forums that Fahima is trying to do here as well is to sort of encourage people that data, whilst it's great for your insights, can be used, particularly in the social sector, to create change. So these are just a couple of small examples. And I didn't really say much about the organisation that I work in at the moment, but we're a small, medium-sized NGO in Wellington working in homelessness. And so the people that we particularly support are people who are have lots of complex needs. They're the hardest to reach often, is what people would say about them. They're often excluded from other organisations and find it really challenging to access resources that we would say are their human right. So I've got a few examples from that space. A little while ago, I'd heard from one of the government departments that they were prioritising a certain population of people to access their resource. And I knew that we worked with that group of people, but that they weren't having access to the resource that apparently they were meant to be getting. And so what I did is utilised our relationship and presented a suite of data for them to say, this is how many people that we in our one single organisation in this city are supporting that meet your criteria. And all of these, not names, but this number of people are not able to access that resource that you said that they should be having access to. So it sort of took it from this is what we are doing, this is what will be happening, to, well, this is what is happening on the ground, and here's the people that are still constantly being excluded from access to that resource. And the result of that is that that particular government department came forward with some practical solutions to that. Another example is where we want to make the point that our service in particular is supporting people with very complex, high and complex needs, essentially. And so one of the points of data that we collect through observation, through conversations, through reports that we're given, is what we call complexity factors. So these are things like the person has a criminal history, they have a mental health diagnosis, they have an active addiction, etc., etc. And one of our services that we looked at, our mental health service, we focused on that specifically. And what we have found that over 45% of the people that are in that service have 4 or more complex factors. And that just painted the picture for us to present to our funder to show that the work that we are doing at this grassroots level with this population of people who are unable to access secondary mental health services, that's who we're working with. And in some ways, the work that we're doing is preventing that person from needing to be able to access expensive secondary services. And we also recently had the Minister for Mental Health here. And when you think about who your data is for, often in social sector, our data is for ministers and for our colleagues in government departments to make a point about the services that we're delivering. And so it's powerful to be able to both give narrative and data like that one to your minister. Our third one was around the number of people that we support under a particular service that are meant to be able to access housing but can't. And again, similar to the first example, it's being able to challenge the assumption that because a policy or because a process is already in place, that therefore everyone should be able to work through that process and receive the services that they're entitled to. And so for us in the sector, when you can see that there is a process in place, but that the end user isn't able to access the service through that process, to use your data and evidence to be able to make that point. So it's similar to the first one, but being able to show that we had a group of people who had a right to access a particular thing, and how many of the people were on our service were unable to access that. So just a couple of examples where using our data and evidence has been able to shift a thought or plant a seed for advocacy for the future. So something else to consider. So I kind of, I think sort of thinking about, often we think about who's our service users and our end users, right? And we're thinking about our clients, but what about a new practice or behaviour that you're embedding in your organisation? So I don't know if anyone in the room has done any, say, motivational interviewing training or anything like that. I'm a social worker, so that's something that I've done, but I understand that that's not everyone else's pathway. But I'll use it as an example. In motivational interviewing, if you want to become someone who uses that in your practice, which is essentially a different way of asking questions of somebody to help them grow and change in their life, you film yourself doing your engagement with a person, and what you're looking for is to see how many times you might ask an open-ended question, or how many times you might make a suggestion where perhaps you probably could have asked a question or just kept quiet. And so the intent of recording yourself and looking at that, whilst it feels uncomfortable, is actually around bringing your insight and focus into your behaviour, and with a hope to increase good behaviour and decrease some of the bad behaviour. I also think about opportunities for, this is a crazy example here, guys, but thinking about where you're trying to change some of your own behaviour in your organisation, and you know that you are someone that interrupts people quite a lot when they're talking, because you've got a great idea and you really want to share it. So perhaps you might want to ask a colleague to make a little note every time you do it, or something like that, so that you can get some feedback about a behaviour that you're trying to change. I mean, it's a silly example, but I'm trying to think about things that enhance our work and our engagement with people and our practice. And so it's not always about data and evidence about clients, but there's some stuff that you can gain for your own insights and your own learning about yourself. One of the things that we've come to in our organisation is wanting to understand the competency and the skill and the knowledge and the area, the knowledge gaps that we have in our own staffing. That comes back to some of our strategic goals about what do we want to deliver. Well, we want to deliver this. So do we have the right resources to do that? Resources being, bodies on the ground, vehicles perhaps, computers, but what about the skills that your staff have? Do you have the right skilled resource, skilled staff to be able to deliver? And how do you know what your skills gaps are? Now, if you're a small organisation, you probably know that quite well. You'll be spending time with people and you'll get an understanding of when you need to recruit, what are some of the gaps that you have within your team that you need to recruit for. As you get bigger, that becomes a little bit harder to do. So there are things that you could do as an organisation to understand the skills and the areas of expertise that you have in your team, and knowing what it is that you need to deliver, looking at whether or not you have gaps in that, and thinking about recruitment into the skills rather than just a body on the ground. And I think we do that, we sort of do that anyway, but what I'm talking about is utilising data for that. So, for example, we've recently introduced a new performance appraisal tool where we assess and people self-assess, and we give them a numerical rating. It's not completely unusual. It's sort of almost probably standard practice. But what we've done is collate those ratings across the organisation. We can drill down into teams, and we can see where in the teams have we got some real strength through the numerical rating, and where are some of those areas and those gaps that we need to fill. And then we kind of can suggest maybe looking at well-being. So again, some of these things are gut feeling or assumption that we might have, but what about whether or not we look at the number of sick days that people have versus the number of supervision sessions that they're attending? For example, is someone off sick quite a bit or putting in stress reports quite often, but when you look at your accounting software or your invoicing, you're noticing that they're not actually attending their mandatory supervision. And so those are just sort of ways at looking at data to inform your gut and your conversations with people. So I've talked quite a bit. How about you do a little exercise on your own? I'll give you sort of 1 or 2 minutes. Thinking about all the things that I've shared, thinking about your own organisation, what is one piece of data that you wish that you had access to in your role? And just take a couple of minutes to jot that down.
You can drop it in the Q&A chat box. So possibly, Natalia, if it's not accessible to you, I can read them through.
Well, you could do, but maybe just jot it on a piece of paper, because I'm going to ask you another question in a minute and see if that's still a question. Hopefully you've had a chance to think about that. My follow-up question is, well, it's more of a challenge really. Look at that piece of data and go through that 5 whys. So why do you want that piece of data? Whatever that answer is, ask why again on that. Whatever that answer is, ask why and continue to do that. And then you may want to cross that thing out. Perhaps that isn't a piece of data that's particularly helpful. Perhaps that's not something that you need, or maybe it will be something that that there's some really good reason for. So I'll give you a couple of minutes to think about that. Now, if that question is still there and you are still thinking, yeah, no, there's good reason why I would like this data, then I guess your challenge is how you're going to go away and find that. Which kind of moves us into our next part. How do you get data? So I suggest start with a system map. And these are things that I've learned along the way myself. What have you already got in place? What are all the tools that you've got in place to collect information that tells you something about your business, that tells you something about the people that you work with, that tells you something about the people you're supporting? So what have you got? What do you have? What do they do? Is there anything missing within that? Is there anything that any information that you're sort of doing manually that you shouldn't? So have a look at what systems you've already got in place and consider consider what the gaps are. When there's something about integration here, so often you end up with duplicate or multiple systems. Some will duplicate what others can do. So have a look and have a think about whether or not you've got the right systems, or if you've got too many. Often in organisations, you sort of iteratively add bits and pieces on, and it takes a bit of courage to pull things away. But also, it's time consuming sometimes to have multiple systems that are perhaps not even talking to or integrated with each other. For example, and this might not be wrong, but I'm just putting it out there, if you're in a client delivery service, there will be times where things will happen with your staff, with a client, and they'll need to record that both in the client management system, but also in your health and safety system. We're talking about two different systems for the one same event, and it might be that that's appropriate, but you might want to also ask, is there a clear understanding of what goes where? And is there any ability to integrate systems so that there's not duplication of work? Sometimes data can't be pulled from one system. You might be thinking about sort of using proxies like staff to measure staff wellbeing. So I talked before about the number of sick days. So you might want to have a look at your payroll system to see how many sick days somebody's having, or that are being taken in a particular team within the organisation. Then you might want to have a look at your accounting software to see have you paid for supervision sessions, or has this person gone to some counselling sessions, and then to look at your health and safety log to see if stress reports have been put in. That's just an example of where you will have multiple systems, and to answer one single question, it might require you to gather data from multiple places. And this is this thing around integration. It's not perfect, especially when you're in a small organisation. Often you don't have the time to do that, the integration. And this is where some of these things are a bit of a luxury. But I guess I'm putting it out there that we have this information in multiple different places, and yet you need it to inform an assumption, or to test an assumption, or to inform a next step. So have a think about that. I said before that I had, did I say? Yeah, that I'd worked in quality assurance. And what I learned along the way is that my understanding of a particular activity or request is not going to be necessarily the same as everybody else's. So when you're talking about data integrity, and if something's very critical to your business, you want to make sure that any person who's entering data into your system, whether it be numbers or narrative, understands what it is that what's required from them, and can interpret and has the same interpretation of that as the next person and the next person, so that you're reducing the bias or subjectivity when people are responding to things. So I'll give you an example. We've recently introduced a new assessment tool into our organisation, and what we really wanted to understand is of the cohort of people that we support, where are people at? Where are people at in terms of their connection back with their whānau? And so we've asked a broad question, and within that we've given some numerical ratings. But for me, a 5 out of 5 might mean something different to somebody else, or a 3 out of 5 might mean something different to somebody. So we've given really clear guidance around what these numerical ratings would look like, to try and reduce the bias and include some objectivity when the frontline workers are using this assessment tool. On one hand, it doesn't really matter what the number is for the person, for the face-to-face engagement with the person that you're working with. If they feel like it's 3 out of 5 or whatever, it doesn't matter. It's more around the conversation with that person and a plan that comes afterwards. But if the business is needing that information and that data to perhaps 3 or 6 months later review that and see whether or not any of your outputs have made a difference to that person or that group of people's connection with their whānau, then you need to have confidence that the data that's going in is accurate and consistent. So the quality assurance is really important. And I don't know about you, but we have a lot of limitations in the way that we interpret and use our data in our organisation. Social and human data isn't static. In our organisation, we've prioritised our own organisation's insights at the cost of having consistent data when we're talking with the media. Now, I'll give you an example of that. Media come to you and they ask us, for example, how many people were rough sleeping within this period of time. So we answer that question as best as we can based on the data that we have. That's based on somebody coming through our service in that period of time and telling us that they are rough sleeping within that period. So we know the data from that point to that point at the point that we've been asked that. But 2 months later, I don't know, 50 of those people come back and they tell us, oh no, I wasn't rough sleeping during that time, or oh no, I was in this property or that property. And so we go and backdate our data to make sure our data is accurate. But now that number that we've given the media about how many people were rough sleeping within that period has changed. So my point is that we prioritise our data integrity. We've prioritised our own insights and accuracy around the story that's told within our database at the cost of confusing, I suppose, the narrative and the data that we've given to even to our funders and our contract providers. We're often tidying up data which changes numbers. It can impact all sorts of things, but being mindful and thoughtful about whether or not you do that and why you might do that is important. I think we'll skip that if you want to at some other point, just thinking about the systems that you have in place and what are some of the systems that you've got currently in place or that you might need to have in place to start measuring perhaps that new piece of data that you were interested in exploring or something else that you've thought of. We're near the end, everyone, so if you've got any questions, start jotting them down now or having a think about what they might be to share shortly. A couple of things around humans. When it comes to social services, we're so reliant on people being able to interpret and make time for data. My experience is that you really need people with an understanding and wanting to buy into the data. People are busy. They're doing their BAU, and often, particularly in social work settings, they don't necessarily see data entry as the most critical piece of their work. And it's not, but as you know, it's important. So I suggest starting small. My experience has been finding a couple of people who are champions, who are keen, are interested. They don't necessarily need to be maths gurus or particularly skilled, but if they've got an interest and they want to be involved, then start with those people, because they're the ones that become the champion for the rest of the population in your team. And be really clear about the purpose. So being clear about what it's going to be used for, about why, and showing them the dashboard, like the end point. Hey, this is why the data is so important, because we use this for this. For example, thank you for putting the data in around the complex factors that you're noticing in the people that you're working with. When the minister came in the other day, we got to share that data with him, and it really made the point to him that, you know, So bringing people on to the purpose and the value of their time and energy and adding information into systems is really helpful. A little bit of an example around the consultation, collaboration, co-design. So we were recently involved in a nationwide pilot around a sort of an entry, like an intake piece of work for people coming to our service, and there were 5 organisations in the country that were doing it. So I felt very privileged that we were one of 5 that were going to be part of this pilot. and was super motivated, had been part of designing what the questions would be for this, how we'd present it, all the rest of it. But it was just me. And to be honest, I was never going to be the one sitting with the clients asking these questions as they were coming through the doors, right? So I was trying to push it out to the staff. Come on, guys, how have you gone? Have you done your entry point surveys today? And really trying to build momentum and enthusiasm for it. And people didn't understand kind of why or what it was for. They're bright people, but they didn't really have any buy-in. They cared, but probably not that much. They couldn't see the relevance of that. It was only when we went to a conference, a national conference, towards the end of that year, where our data was shared in this wider group as this pilot, that a couple of those people who were at the conference were like, oh, that was what it was for. And I just realized how important it is to get people in on the purpose and as much as possible in early for that co-design and that collaboration phase, so that they understand why you're doing it and they get some momentum around it. And this comes back to people understanding and being engaged with what you're doing and seeing it as part of their work and having an impact. And I'm particularly bang on about advocacy, because I think when we're talking about people in social sector, it is about change. It's about seeing something happen that's different from what we're currently doing because of some information that we've now provided. And then we've got the end user. So we've got those people who use our information at the other side. Now, I mentioned at the start that I'm afraid of numbers. Maths is not my strong suit. And as I've moved into this new role, I'm a CEO, and I'm now responsible for budgets and all these other things. And we have an accountant who looks at spreadsheets with 20 tabs and 500 lines and a billion numbers on it. And she looks at it and she can absolutely interpret it. It comes alive to her. As soon as I look at it, my brain shuts down. And so I'm an end user of her data. And so I've greatly appreciated our data analysts coming in, taking that information, putting it into a dashboard with, like the Rose diagram, the Florence Nightingale diagram before, putting it into bold colors, color coding, bold or lighter for where there's something I need to take note of, and reordering a few things for me. So I'm an end user. Now you will have end users. You'll be an end user of data yourself, and you'll have other people on the other side that you're providing information to. There's this kind of idea of the golden rule: treat others as you would want to be treated. And I went to a leadership course a year ago, and they talked about the platinum rule, which is treat others as they need to be treated or as they want to be treated, because we're not all the same. And so find out what it is that person on the other side receiving your information, find out what it is that they need from their information, but not just the information itself, but how do they like it to be presented so that it means something to them, so that it's useful for them, so that they can do something with it, because that's a huge part of engagement. We also want to think about narrative and numbers. And so I would say, particularly in this work, that we need to be careful about how we use narrative and numbers. I myself have an example of being so moved by something that I'd seen happen within a role, previous organisation, OT, that I was in, where I'd see something happen and want to and made the issue bigger than it was. The numbers around how many times this thing happened didn't back up the concern that I had. But because I'd seen one or two things happen and I felt so moved by it, I sort of played up the problem that was there. But I should have actually been guided by, how often is this thing happening? Is this really a problem? And then use some narrative to back up the story around that. So there's something about, there's some wisdom, I suppose, to be considerate of the fact that we have access to some data, we also have access to narrative, but to not conflate the issue, I suppose, is the point that I'm trying to make. Or being mindful of when and how you do that, and knowing that that's a choice that you're making, that you're choosing to make around that information sharing and how we bring data alive. I would say that it depends on who you're meeting with, and again, coming back to what are their needs, because some people are only interested in numbers, and some want the stories. So being mindful of that. Look, we'll wrap it up, because this is a lot of information, and I'm keen for some Q&A. I myself have some questions, not for now, but would love to get some feedback about the things that we've talked about today. And so if we were to do this in the future, what are some things that you would hope that we would have covered, and other things like that. But we'll move on to, this is just the summary of what we've gone through. Data helps us to understand what's really happening. It supports decision making across the board. I didn't talk about outcomes, but we need to be thinking about, are we measuring what outputs, or are we measuring impact, which is something that a lot of us in the social sector are already talking about and have been for a few years. Thinking about your audience, who is it that needs what, how do they want it presented, what systems have you got in place, are there things that you're missing, are there things that you've got duplicate points of evidence from that you might want to think about consolidating what you've got, and that knowing that it's a tool for improvement. Ooh, okay, Pārtai, any questions, feedback questions?
Hi Natalia, Liz here.
Hello, Liz.
We all know the media love to not necessarily represent data the way it was intended. How do you deal with that?
Yeah, I've started to think about training the journalists, and so for us, we've got a couple of people that we kind of go to proactively. What I've tried to do is just have a free and frank conversation with them as well, and go, hey, look, you need to understand that this is what we're trying to, this is the message that we're trying to get across here, and almost give them, like, take away their ability to interpret and say these are the words that need to be said, but help them to understand why. But I find that when we've built some relationships with a couple of people, they've started to understand what it is that we're doing and why we're doing it. It's harder when you've got people that you haven't met before, don't have any engagement with, that come across and kind of just want a soundbite. So in some ways, I sort of tend to give them quite broad, non-specific information, because they don't understand the caveats around things. But training the journalists has been my learning from the short time I've been in this role.
Awesome, thank you.
We do have one question. Yes, go ahead, please.
Yeah, I'll follow up on Liz's question about when your funders ask for data that you might feel is too hard to get or breaches confidentiality. I mean, I know funders are so interested in the human stories, but then sometimes it feels like we put the people we serve out there as like a circus act or something. It's just hard to balance that, isn't it?
Yes. Yeah, I've been thinking, I think we've got some really great relationships with some of our funders, and there are a couple where we would go sort of above and beyond, because we know and we trust what they're going to do with that information, and that they're not asking because just because, but because they're really interested in doing something about what we've shared with them. And then there are others where you know that you're part of a wider data collection scheme, and it's not really going to be used for something. And I think, yeah, where there are, my view is that where you've got a trusted relationship with somebody from one of your contractors, and they're asking for more, I'm inclined to say yes, where I know and believe that they'll do something good with that information. And then I push back a little bit on the ones that you think they're asking just for the sake of asking. But it is tricky when they're funding you and you're pushing back. But we've got examples of where we've got a very collaborative relationship with one of our funders, and we together with them have actually basically redesigned what it is that we'd be reporting to them, because what they had initially asked for felt like ticking boxes, and wasn't actually going to give them any information that would inform their planning. And it wasn't really useful for us either, and there was so much more that we wanted to provide them. So we worked sort of collaboratively, in a collaboration about what that would look like, and pushed back on a few things where we felt like that wasn't going to add value to them or to us, but they thought it was a nice to have, so could push back on that. But that co-design, I've only experienced that with one organisation around that co-design, but it was pretty powerful, and it probably should be a model for going forward for contract partnerships.
Oh, that was what we heard from Ingrid, that she mentioned it. Yes. Any other questions? Remind me, I would like to add, Natalia, to that point of the co-design, or the question that Ingrid raised around, additional data, is just the value for the funders always is something that is not quite articulated well to your organization. So understanding the why they are asking this, having an informal catch up to have some communication, I think is going to help big time with clarity in the direction and the relationship in between the funders and the organization, the NGOs. And also, I just strongly believe that they are really open to collaboration, but they don't know usually the nature of your work as a social worker. What I experienced, it was just something that the story that you talk is quite hard for them to understand, because they are not, or they never come to the front line of your services to see what's happening on the ground. So that could be the reason that more clarity is going to resolve that issues and challenges around the metrics that they are requiring. And for the sake of the contracts, always agreeing the metrics upfront. So that is something that most of the time make the life quite challenging. Any other question? As Natalia mentioned, we would like to hear your feedback or any other interest you might have for these type of the topics that we can accommodate and launch in 2026. We would love this platform to create knowledge sharing and impacting the community, the work that especially in the social work industry you are doing, and informing the change that needed, not that bringing amount of the changes and introducing those type of the changes that is not really necessary for your sector, but making sure informing the changes for the future, especially with the digital transformation, data-driven transformation, and the adoption of AI, which is quite fascinating how it is changing the whole of the industry and the whole of the world, to say. Thank you for joining. Thank you so much, Natalia, for your support and your time. I really appreciate it. So whoever participated, you're going to receive the certificate for your participation and the QR code to claim your CPD or the PDU, Professional Development Unit. We really appreciate your support joining us, and enjoy your afternoon. Thank you.
Thanks, everyone.
Thank you.